You know, there are some pretty scary predictions out there about the number of Ebola cases in Liberia and Sierra Leone. And they're coming from a reputable source, the Centers for Disease Control. If unchecked, CDC doctors say the number of cases could rise to as high as 1.4 million. Now, with proper medical care, they say the epidemic could decrease and eventually end, but helping to get medical supplies to one African nation is the goal of Nigerian physicians in the Americas. And Fox 13 anchor Greg Coy spoke to one of those doctors to get an update.
Look for lymph nodes like this. Bend your head down a little bit.
Treating lung cancer patients is his passion.
And that's his lung cancer there.
Being the lead physician on a national study to improve cancer treatment is his recent mission.
Making sure people get the right thing that they need, not just because that's what the doctor knows.
But the latest personal calling for this Nigerian-born doctor at Baptist Medical Group is helping to fight Ebola before it takes hold in his native country.
A lot of doctors, a lot of nurses, a lot of hospital staff have died. And the reason why they have died is they don't have simple protective gear.
Surgical gloves are in high demand in Nigeria as that country fights Ebola from spreading. It is why this Memphis doctor and other Nigerian physicians around the Americas are raising money, public awareness, and collecting supplies.
The materials that we have that we never use, that we throw away, those things would be of major benefit to these societies, these hospitals.
Experts say the Ebola epidemic needs international effort, millions of dollars to support medical teams in the impacted areas. This online campaign among physicians is a small step, but an important one.
I have donated. I have also gotten together with some of my colleagues to try to identify where we can find some of these personal protective equipment that we can ship to a central site in California to be shipped down to Nigeria.
In Memphis, I'm Greg Coy, Fox 13.